Welcome to our January 19th, 2016 webinar, an overview of current research and implementation best practices in Wraparound. I'm John Osowski, the project manager for the National Wraparound Initiative, and I'd like to begin with a few housekeeping announcements. Please see the advice on this slide to make sure you make the most of your GoToMeeting experience. In particular, please note that during the presentation, all audience members will be muted, but you can send your questions to us via the chat feature. There will be time for questions and answers at the end, and a recording of this webinar will be made online very shortly after this webinar ends, along with several important research sheets that we're going to reference in this webinar. I'd like to invite all of you who registered and your friends to stay in touch with us at the National Wraparound Initiative by signing up for our monthly newsletter. We feature links to NWI resources like this webinar, as well as news and events of interest to the field. Announcements about the 2016 National Wraparound Implementation Academy scheduled for fall of 2016 will also be included in this newsletter. You'll receive an invitation email after the webinar, and we hope you'll accept it. You can sign up on your own from our homepage at nwi.pdx.edu. Just scroll down to the bottom and complete our quick newsletter sign-up form. This webinar is brought to you by the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health, NTAC, operated by the National Technical Assistance Network for Children's Behavioral Health, the TA Network, funded by the Substance Abuse and Mental Health Services Administration, SAMHSA, Center for Mental Health Services, Child, Adolescent, and Family Branch. And I'd like to invite Janet Walker to welcome us to today's webinar.
Well, thank you, John, and welcome everyone to today's webinar, which is entitled An Overview of Current Research and Implementation Best Practices in Wraparound. As you've just heard, I'm Janet Walker, and the other presenter today will be Eric Bruns. For about the last 15 years, Eric and I have been co-directing the National Wraparound Initiative, or NWI, as you've heard it called. Eric is particularly engaged with the fidelity assessment and quality assurance in Wraparound, though his research also covers a variety of other topics related to Wraparound and beyond. Eric is a clinical psychologist and professor in the Department of Psychiatry and Behavioral Sciences at the University of Washington School of Medicine. He leads the Wraparound evaluation and research team at UW. As for me, I am a research professor at the Regional Research Institute in the School of Social Work at Portland State University in Oregon. My specific areas of focus within Wraparound include workforce development, engaging families and young people in Wraparound, and peer support. And as we often do when we start out the webinars, we'd like to find out a little bit about you. So we're going to really quick launch our first poll where we ask you about your role with relation to Wraparound. And we're going to do these polls really quickly, so as soon as you see one, jump in and vote. I'm going to read the responses, and when I get done, we're going to show you what we have found. So please describe your primary role in your Wraparound Initiative system of care. You may check more than one. Parent, family, and or youth kit, system of care wrap provider, system of care / wrap administrator or manager, researcher or evaluator, or some other role. I'll give you about 5 more seconds to pick one of those, and then let's see what we've got. Okay, instant feedback. So we see we have almost a tie straight up there between people who are involved as wrap or system of care providers and administrators, some other role, another popular choice, and also a substantial representation of researchers, evaluators, as well as parent, family, youth, etc. Okay, so now we know who's here. I'm going to turn it over to Eric, who's going to do a little introduction and orient you to the content for today's webinar.
Thank you so much, Janet. So good morning or afternoon, depending on where you are across the country. Hope everyone had a great weekend. Now, as Janet referenced, the National Wraparound Initiative was launched well over 10 years ago at this point to better define the wraparound practice model and the system elements that are needed to support it. So today we're going to talk a little bit about the many things we've learned in our journey ourselves and our many hundreds of NWI advisors who have worked with us over the years in terms of what is the importance of wraparound quality, fidelity, and implementation support. That really is the theme today. It's a sincere pleasure doing this first NWI webinar here of 2016. What we're going to be talking about are research-based innovations in implementing wraparound and building systems of care for children with the most complex needs in their families. The reason that we're going to be, that we're so excited about this webinar today is that since we were launched over 10 years ago, the NWI has really moved into a role of providing information to the field and serving as an active support to system reform and implementation of high-quality wraparound teamwork. We feel like we've moved beyond some of the basic definitional and research issues we needed to do 10 or 15 years ago, and now we're out there supporting implementation. Largely we're doing that, John, if you can go ahead to the next slide, through the National Wraparound Implementation Center. We affectionately refer to the Implementation Center as NWIC, and NWIC trains and coaches people in key roles for wraparound on how to be skilled wraparound facilitators, peer partners, and supervisors, and so on. Now, in this role, we provide extensive consultation. We're working in about 10 states. This map here shows a few of them that we were working with a little while ago, and some more have come on board since. So the reason we decided to do this webinar is we're often in these states and systems reviewing these implementation options at system and service levels and how important they are to build those supports with the leadership in these places. And so essentially today we're bringing this kind of traveling roadshow to a bigger audience via a webinar. But as Janet and John both said, if we were to try and review all this information across all of these areas, it would take way too much time. Thinking about how to get these innovations in place in systems often takes months or years for states to accomplish. And we've been told it's pretty important to keep our webinars to an hour or less. So what we're going to do, go ahead to the next slide there, John, is review the very basics of these 5 innovations and provide resource sheets with extensive additional information that you can find on your own. The resources we'll describe today reflect how complex wraparound and care management is and how all these issues need to be attended to. So, but first, before we launch into a review of these 5 innovations that we've selected today to cover, let's just talk a little bit about why these innovations are so important from a family perspective. This may be old information for many of you doing wraparound out there in the field, but new for some of you. So as many of you know, wraparound's origins go back at least to the 1980s when systems were struggling, as they still are, with how best to coordinate care for children with the most complex needs. These youth and families have multiple issues to contend with, and have often experienced, a lot of bad experiences with services in the past in terms of providers who are not engaging of them, did not put them in the driver's seat of their own plans of care. And they're often being served by multiple systems that had their own mandates and funding streams. And so as a result, care gets fragmented, and families have to figure out how to negotiate all these systems and providers themselves without a whole lot of help or support. They're not fully engaged, outcomes were poor, and so often children and youth would wind up in costly and largely ineffective residential and out-of-home placements, primarily due to the system's inability to coordinate care. So as this slide shows, this is what we're trying to overcome, and thanks to Laura Berger-Lucas for kind of putting it in this way. Multiple systems, traditional systems often rely on professionals and result in multiple plans. Next slide, please. So Wraparound provides a method to deal with this. Instead of systems driving the care, the systems actually invest in methods to put the youth and family at the center of the care process. Go ahead and animate the slide, John. The systems then are contributing resources to a centralized care coordination process rather than requiring a single plan for each one of the systems. Keep going, John. And the system invests in skilled facilitators who can help engage families, identify their priority needs, and navigate these systems with help and support. And most important, implement a single coordinated plan of care that only identifies a couple of high priority needs as opposed to what we often find, which is many, many plans of care and many, many goals that are being worked upon, many, many helpers that are not coordinated in their efforts. Finish the animation there, John, and you can see there how the idea here is investing in facilitators, bringing resources together from multiple systems, bringing natural supports and community supports to bear to a single plan that can be managed by that facilitator, often with the help of a parent or youth partner. Next slide. So over time, wraparound practice, how you actually achieve that on the ground level and at a team level, has evolved and become better and better defined and better supported by workforce supports to those who are in these key roles, as we'll talk about in a minute. The practice model has been defined and continues to be refined. We have 4 phases of wraparound that are described as the way in which the sequence of activities get done. Go ahead to the next slide there, John. And for many, many years, all the way back to the 1990s, there have been defined principles of wraparound that really represent the foundation of what our work should be like. That the effort that is undertaken on behalf of the family results in an individualized plan of care. Strengths are leveraged as opposed to looking at the family through a deficit-based lens. Natural supports are brought into the process. Culturally competent and team-based care is provided. And our big one, outcome-based, references the fact that in high-quality wraparound, we have very clear needs that we're working on behalf of the family and defined outcomes for each one of those needs that are being measured regularly and fed back into the team process. One of the big things we say in wraparound is that people or families don't fail, plans fail. If progress is measured and it's clear that progress is not being made, we change the plan of care and the team rallies around that effort on behalf of the family rather than blaming and shaming the family. Next slide, please. Now, as the practice model has become better defined, and this has become more and more of an approach that's being used out there, we've seen many, many research studies that have accumulated. At least 13 controlled studies of wraparound are now in publications, peer-reviewed publications out there. You can find all of these on our website, or summaries of all these on our websites. We won't review them here. Next slide, please. But the summary message, the takeaway is that the majority of these studies are quite positive and find more frequently than not that wraparound conditions, children and youth and families in wraparound conditions experience better outcomes, reduced recidivism, better juvenile justice outcomes, improved school success, even more positive child welfare outcomes when wraparound is implemented in a child welfare context. This last bullet here really tells a big story of wraparound, that a really major and consistent finding that we see is lower costs and fewer residential or inpatient stays. Only one of these sub-bullets here have been found in peer-reviewed articles in a controlled study, but over and over again, sites like Wraparound Milwaukee, the MISPI program in Massachusetts, LA County, California, New Jersey, Maine, they have all evaluated their wraparound initiatives and found extraordinary reductions in costs for restrictive out-of-home placements, even as they increase the amount of community-based support that's provided through wraparound and community-based services. It's overall saving or cost neutral because we were able to keep kids in home, in school and out of trouble, and reducing those costs of residential and inpatient stays. Next slide, please. Okay, but some of these studies are not so positive, including one that I conducted with federal funds. And we find instances over and over again where wraparound outcomes are actually not any better. They're not usually worse, but no better than case management as usual or usual care services. And what we find is that outcomes depend on the quality of implementation. So at a practice level, certain red flags are all too common and compromise the outcomes of children and families. Wraparound teams often fail to engage those key individuals and natural supports, connect youth in community activities and families into their broader community, actually use and leverage family and community strengths, incorporate evidence-based clinical strategies to meet needs. These are all things that need to occur at a practice level if we're going to get positive outcomes. Next slide, please. To achieve these things at a service level, we need to ensure that certain system and program supports get in place. The bottom line is these kinds of programs and system supports, such as having a broad, diverse community coalition or community team to support wraparound, investing in skill development for workers in key wraparound roles, investing in and organizing a comprehensive array of community-based services and supports, investing in services that are based on research, and building data systems that can provide that needed accountability and information. These are things that also don't happen often enough or consistently enough. And it's these things, these kinds of program and system supports that make good practice happen. Next slide. So it's our experience that it's these program and system supports, particularly training, coaching, and quality assurance among them, that leads to high quality practice at a team level and service level, and gets our families and youth the help they need to experience positive outcomes. So that brings us to our topic for today. We're going to talk about 5 key innovations for which we've prepared summaries of resources that you can go to and find on the NWI website very shortly after the conclusion of this webinar. The first, go ahead and go through these, John, is investing in comprehensive workforce development, staff selection, training, coaching, supervision, and so forth. Janet's going to cover that first. Then I'm going to come back and talk about a huge innovation that's occurring out there in the field, which is providing care to youth with the most complex needs via care management entities, or CMEs, that provide a true loci of accountability. A third innovation we'll talk about is ensuring that clinical care is based on evidence for effectiveness while also being aligned with wraparound principles. A fourth innovation, investing in continual quality improvement and data systems that provide that real-time decision support. And then finally, Janet's going to come back and talk about our fifth, maybe even most important innovation, which is how states and communities are investing in parents and youth, family and youth-led organizations, peer-to-peer support, family-youth engagement. There are many other things we could focus on. But these are the 5 we're going to talk about today and for which we've provided some summaries of resources that we have and that our partners in the TA network have as well. These innovations are also aligned with the key implementation drivers for innovative practices that have been identified and defined by entities such as the National Implementation Research Network. Go ahead and animate, John. These fall into 3 main areas. To get to effective services, we need staff competency on one side of the triangle, organization and system interventions on a second, and then leadership, which provides a good segue to our first innovation in wraparound, this left-hand side of the triangle. You need this 3-legged stool in our systems of care, so to speak. And the first one we're going to talk about is ensuring staff competency and skills through effective staff selection, training, and coaching. And with that, I will hand it to Janet.
Thanks again, Eric. So one thing that has always stood out for me over the years that I've been involved with wraparound, both research and practice, is the incredible variety of skills that are needed by staff who have these key roles in wraparound. To start out with, they need to be able to work in a strengths-based and an empowerment-oriented way with young people and families. They need to be able to promote collaborative relationships between and among family members and service and support providers, often from a variety of different agencies and backgrounds. And they need to guide and or support collaborative efforts to create, monitor, and carry out a wraparound team plan. And none of these, even taken alone, is very easy. Next, please. So a couple years ago...
Sorry, did you want to run the next poll?
Oh, no, I have it coming up in just a bit.
Okay.
A couple years ago, we convened the National Wraparound Initiative experts to create a formal consensus document that would describe best practice for ensuring that wraparound staff in these key roles actually do acquire the skills that they need. So we engaged our expert advisors in a formal consensus building process and developed guidelines that are consistent both with their expert knowledge as well as with the evidence-based practice from implementation science. Next, please. So I would encourage you, if you have at all an interest in this topic, to take a look at the document. It's not particularly long, but briefly, it describes skill development as happening across 3 phases. The phases represent a gradual shift from first just sort of learning about and then imitating practice to skilled performance as a trainee deepens their understanding of what they are doing and why they're doing that. Across all the phases, and this is represented by the orange arrow down at the bottom, we see training, coaching, and supervision should be themselves consistent with key wraparound principles. So we're treating our staff the same way with a lot of the same principles that we see in wraparound practice. So we want the supervision and coaching to be strengths-based, data-informed, and always respectful of children and families. So in the first phase can be described as an orientation phase, and this is supposed to happen before any work with families starts. And at that point, the trainee has exposure to wraparound theory, history, and concepts. They have a chance to see practice examples of the wraparound practice either live or by video, and a chance to practice, say, through role play or other kind of simulated practice. The next phase we call apprenticeship, which is where a trainee is working with an experienced person in a coach role, and that could be a peer or someone who is coming in from outside, or it could be the supervisor, etc. And the goal is to develop a basic competence and confidence with the wraparound process. So the trainee starts as an observer and has the chance to do a little bit of shadowing, and then gradually the role shifts so that the trainee becomes the one who is observed by the coach. The coach gives feedback so that the trainee knows how they're doing, and that the feedback includes data from a reliable assessment so that the trainee can be confident that what is being seen is something that isn't just whatever the coach is making up at the minute, but actually represents what any reliable coach would say about their practice. And then this apprenticeship phase kind of ends when when the trainee has reached a level of practice that we would identify as sort of a benchmark score on the assessment and has completed a sufficient number of observations. And then the final phase recognizes that there's ongoing development in the process of acquiring a real expert or expertise, and that there also needs to be ongoing periodic, although perhaps not very frequent, observation and document review to guard against drift so that we can ensure people are still practicing in a way that's consistent with wraparound. Now I'm guessing that for some folks best practices like these are going to sound like something that could only be achieved in some kind of fictional wraparound utopia, but I do want to emphasize that these are practices that have been in place in real life settings, including the settings where our NWI advisors work, but also the settings where NWIC staff have come to support states and localities. And as Eric was mentioning, the National Wraparound Implementation Center follows this kind of module and progression in all of their training and coaching and supervision. So I want to do a quick poll now to see what it is that you all are currently have the resources to do in your sites as far as some of these practices that are related to training, coaching, and supervision. So again, you can pick more than one here for the program you're involved with or most familiar. Training, coaching, and supervision for wraparound facilitators, we're just focusing on them at this exact minute, includes which of these? Observing expert rep practice as an apprentice, receiving periodic coaching that includes observation, getting intensive coaching until benchmarks are achieved, getting coaching and supervision that uses a structured format, and getting data from reliable assessments to monitor skill level. So we'll give folks, because those are a little bit long responses, maybe just 5 more seconds, so vote now. And then Amy, when you get a chance, if you can close that and we'll be able to look at the results. Okay, so I have to say I find this very hopeful. We see that
very encouraging.
Yeah, and I think that every time we do these polls in general, we see that there's more of what we hope to see than there was the last time. So I'm gratified when we see those kind of things, especially here that people are not only using a structured format for coaching and supervision, but that people are getting observed, which I think is a very important part of developing expert practice. Almost half of people have the opportunity to observe expert RAP practice, and as an apprentice, I think that's great. And actually, I find these numbers are a happy surprise. Then still a third of people are getting intensive coaching until benchmarks achieve. Okay. Thank you very much. So, great, we don't have to leave that all for the Wraparound Utopia. Next slide, please. And just as a side point, one of the ways that NWIC makes it possible to do observation and coaching is partially through the use of what we call this remote coaching capacity, something that we've actually developed here at Portland State University, this tool that makes it kind of easier and more practical, especially from a cost standpoint, to do observation, as the observation is based on video that can be taken with a laptop webcam or a tiny flip cam or even a phone. And of course you can find out more about that if you're interested. Okay, next please. And this is just a quick look to, just go ahead and make the whole slide appear there. This is actually a study that Eric mentioned before, looking at relevant findings from a study that in Nevada that he was the lead on. And this is looking at wraparound fidelity index measures that are looking at perceptions of overall practice quality, or the extent to which wraparound is unfolding as it ideally should. And you can see a substantial increase in scores over time across the bottom as components of best practices were added. So you have early initiation of the pilot, then you have intensive training, and then you have the introduction of coaching. And then subsequently a decrease after there was a rapid expansion and dilution of the quality of training and coaching that was provided. So next slide.
Thanks to our colleagues at Vroon Vandenberg for initiating that entire study.
The next slide is just to point out that it wasn't just fidelity but also outcomes that were impacted. And the pilot study you can see is the black line showing decrease in impairment among children who were enrolled in Wraparound. And then with the statewide expansion, which is the blue line, the decrease in impairment was not so steep from baseline to 6 months. So there's a kind of an implied chain of causality where improved coaching, improved practice, and then taking that away had an impact on practice and subsequently on outcomes. Okay, next slide please. And this is just kind of a sneak preview. So as we mentioned, because these topics are, each one is huge and complex, we tried to sort of distill our best thinking into very short resource sheets that would guide you to some of the key resources that you can use to follow up on any of these topics and get more information. And so as John mentioned, we're going to be posting these immediately as the webinar concludes. We'll put the recording of the webinar out on the website and also post the resource sheets. And all of you should be getting a follow-up email reminding you of giving you a direct link in order to access these. Okay, back to you, Eric.
All right. So we're one down, 4 more to go for folks. The next one we're going to talk about, the next innovation that's incredibly exciting, perhaps even more or at least equally exciting to what we just learned, that a lot of wraparound initiatives out there are using some of those more advanced skill development techniques, is how systems at a system level are encouraging that and a whole lot more by using care management entities. Now go ahead to the next slide there. A quick primer on care management entities. So this is kind of over here on the other side of the triangle, where systems intervention, decision support, data systems, and administration are so critical. So at a system level and a fiscal level, how do we make some of this, how do we make this stuff happen? Go to the next slide, please. So as we already discussed, children and adolescents with complex needs often receive fragmented care because they're being served by multiple systems, and that results in poor outcomes. So a number of states and regions, including a bunch of places that NWI is working with, have begun to really demonstrate significant cost savings and improved outcomes for children and youth through the use of the care management entity, or CME model. So CMEs offer a centralized vehicle for coordinating the full array of services and supports for these youth with complex behavioral health issues. And as such, CMEs represent these key organizational drivers. So when care management entities and Wraparound come together, when this happens, states and systems can successfully combine resources from multiple public systems into one locus of accountability and organization and coordination, as opposed to that fragmentation at a system level, facilitating the redirection of dollars from all of those systems' high-cost, poor outcome services like residential, detention, group home services, and invest that savings in home and community-based service capacity upstream. That is the ideal, that is the goal that many, many more states and systems are achieving through CMEs. Go to the next slide. So the most widely disseminated example out there of a CME is probably the oldest, the original, and the recipient of a Harvard Kennedy School of Government Award for Good Government, Wraparound Milwaukee. So Wraparound Milwaukee was a radical experiment in system redesign. Instead of each child-serving system that cares for youth with complex needs serving each of their youth within their own silos, all of the systems, mental health, Medicaid, juvenile justice, child welfare, schools, recognize that these youth are often involved in their other systems in their county as well. And so to avoid that fragmentation and duplication we talked about earlier, they agreed to bring their resources designated to these youth into one common pool of funding. And that is Wraparound Milwaukee, a care management entity or care management organization. $47 million at the time that this slide was created by our friend Bruce Camrat, who launched Wraparound Milwaukee 20 years ago. So then that care management organization spends an average case rate of $3,700 per child per month to do whatever it takes to keep these youth at home, in school, and out of trouble. This is the system and fiscal mechanism through which we actually ensure that children and families receive coordinated care that feels engaging and feels like it makes sense to them despite all of the complexity of our funding streams. So that $47 million and the $3,700 per child per month is spent on whatever services are needed to meet their priority needs. Wraparound Milwaukee spends those dollars on a provider network of over 200 providers and 70 services, intensive care coordinators, family support from a local family organization that has a contract and plays a major role. And all the child-serving agencies agree to participate as makes sense for each child under their purview, but when it comes to coordinating the care and managing the service array, that is ceded largely to Wraparound Milwaukee, the CME. Go ahead to the next slide. So because, as we've already said, we're trying to give you a picture of each of these, but not get into too much depth, just really quickly, this type of approach is now being replicated all over the country in various ways. Thanks largely, again, to the fantastic example provided by Wraparound Milwaukee. But now we've got multiple states out there who also provide examples. Oftentimes, they're investing in regional care management entities that undertake service and system functions. South Carolina is a fantastic example of a state that now has 4 regional CMEs. So at a service level, these CMEs facilitate child and family team facilitation using high-quality wraparound. They do the screening, assessment, and clinical oversight. They do that intensive care coordination. They monitor the plans of care. They provide access and training for peer support partners and mobile crisis. At the system level, next slide, or at the administrative level, what happens is that this care management entity provides the information management, real-time data, web-based information technology that gets outcomes and costs data at the manager's fingertips, but also can look at each care manager's own book of business and say, for the 10 children or families that you're serving, how much are you spending on average? Are we keeping our costs at that $3,700 on average that we get at a case rate? At an administrator level, they manage the provider network, they do utilization management, and they're responsible for training, coaching, and workforce development, not just of the facilitators, but also of the providers out there. So I think it's time we launch the next poll. Kind of curious what folks on the call, on the webinar now, what your experience is about the degree to which the wraparound program with which you're involved or are most familiar. How is your wraparound organized? Is there a central organization like a CME overseeing all of those functions, those service and administrative functions? Or is wraparound delivered as a service by private providers? Or is wraparound delivered as kind of a fee-for-service service by public mental health agencies? Just giving you three options. We're just kind of curious to see what people's experiences are out there and also stimulate your thinking about the fact that there are more options than just Medicaid fee-for-service targeted case management, and that moving towards CMEs is a really innovative step for systems. So what is our results? So we see, actually, again, perhaps encouragingly, there is a CME-like entity in over a quarter of your communities. But more common, and this is what we've seen for many years, wraparound is delivered as a service by private providers or public mental health agencies. Not to necessarily say that that is terrible. It can actually be a very effective and innovative way to get families help. But CMEs are often a way to ensure that all of those system-level functions that are needed to get to good practice occur. And we encourage folks to be learning about those things, about the CME option as well, so that you can educate others in your systems about that this is an option. Go ahead to the next slide there, John. Thank you for voting. So if you want to learn more about the CME approach, really the best place to go, we will have a resource sheet, but one of the places you're going to see multiple times referenced is the Center for Healthcare Strategies website. Probably the most useful document to get to know more about CMEs is Care Management Entities, a primer that was developed by folks like Diana Simons and Sheila Pyries at CHCS 5 years ago. And now they have tons of additional webinars and other fact sheets about CME implementation that you will see on our resource sheet that's available. But you could also just go to chcs.org or just Google CHCS CME and you're going to see a whole bunch of resources. Okay, moving right along. And here is a related topic very near and dear to my heart as a clinical psychologist and researcher, the importance of investing not just in a comprehensive service array, not just in wraparound facilitation, but to pay attention to the degree to which the services that are available to those facilitators and teams are based on evidence for what works. Go ahead to the next slide. This is really pretty straightforward idea here. As you can see, here's a big bird going to the doctor. Our feeling is that youth and families should expect evidence-informed behavioral health services just as they expect proven practices when visiting their doctor, that their doctor will know the best protocols for removing tonsils or setting an arm, taking an x-ray. We owe it to our families to ensure that our service array is capable of meeting the major clinical needs of youth and families who are enrolled in wraparound using research-based practices that can address those needs. You know, Janet did a study over a decade ago that found that across like 15 wraparound programs and 100 plans of care that they reviewed, that every single wraparound plan of care included some sort of therapy. You know, we won't get into whether or not that makes sense, that every single wraparound plan of care includes therapy, but let's face it, our kids have really serious and complex needs, and many of them are clinical needs. Depression, anxiety, effects of past trauma, disruptive behaviors, attention problems, offending behaviors, and so forth. Now, luckily, we have effective practices and interventions for all of these issues. Maybe not research that shows for every age group or every ethnic or racial group, but the majority of those categories of clinical needs, we have effective practices. So the question is, along with other important services, go ahead to the next slide, John, that need to be in our service array so that our wraparound teams are not just wrapping around a donut hole, we have to have things like peer support, respite, mentoring, recreational services, transportation. We also need to have evidence-based clinical services that are built into our service array. So again, we're going to point you to a number of resources that are focused on this issue in our fact sheets. And in these resources and webinars that we've produced in the past and that are coming down the pike from the TA network, we describe what some of these evidence-based services are, where you can find more information about them, and how to support them in your systems and provider organizations in ways that align with wraparound principles. It's not okay to simply refer a young person to an evidence-based treatment and then call it a day. These treatments and these providers need to be part of the wraparound process. They need to be strength-based and engaging. Luckily, that's a common element of a lot of evidence-based practices, is being strength-based, is engagement and education and working collaboratively with families. So how do systems do this? Go back one more, John. How do systems actually apply evidence-based practices to wraparound populations? Just a few bullet points here. System leaders and community teams need to analyze the degree to which clinical needs are covered by local EBP availability and invest strategically to fill those gaps. They need to recognize that investing in intensive community-based EBPs like multisystemic therapy, functional family therapy, triple P, might be able to meet certain wraparound youth and family needs, and during those episodes of care, wraparound might take a back seat while something like MST addresses that minority of youth, but very challenging youth, who are offending or who are engaged in substance abuse. MST is an evidence-based practice and is probably a better option than wraparound, for example, but it's only a small number of complex needs youth that will be eligible for MST in the system. That's why we need to think at a system level, not just at a wraparound level when it comes to organizing our systems and supports. One thing that Pat Miles, wonderful wraparound trainer that many of you know out there, says is that if you know what to do, do it. If you don't know what to do, do wraparound. So we need to invest in the things that might work for families, and it's when the needs are complex or unclear about how we're going to meet them that we do wraparound. Go ahead to the next slide. Now at a provider level, some things we can do out there are train clinicians in the system of care on those EBPs, including modularized EBP approaches that could flexibly meet the needs of youth and families. Things like managing and adapting practice. Here in Washington State, we have something called CBT Plus that allows clinicians to get trained and coached to flexibly meet anxiety, trauma, depression, and disruptive behavior needs. And train and supervise our care coordinators, our facilitators, to understand that plans of care should include EBPs when there is an indicated clinical need, as long as it's something that is embraced by the family, as long as the family's in the driver's seat around having that be part of their plan of care and so forth. I believe we have a poll that we want to launch now. Just curious about folks' experiences out there in terms of your service array and its degree of meeting these two criteria for wraparound programs, again, so that we are not having wraparound teams wrapping around a donut hole. Check all that apply regarding the service array in your wraparound program. Is the service array comprehensive? Does it include services for all those needs? Does it include other things like respite and peer support? Are the services and treatments based on evidence, in your opinion? Are the services in the array managed or at least reviewed by some central entity that is saying, you know, how much coverage do we have of the community supports and clinical services that we need for our wraparound kids? And finally, a big thing that often isn't done as much as we would like, are the services actually individually evaluated for their effectiveness and family satisfaction? Be really curious to see what we have for this poll. And because we are Desperately short on time, as usual. If we're going to get done in an hour, let's see what the results are. So hovering around half of all folks on the webinar feel as though their service array is comprehensive. A lot of folks feel as though the services and treatments are based on evidence, and what's lagging a little bit perhaps is that central management that might happen in a CME model or when there's a community team actively involved. So real interesting results again, but encouraging, I would say. Okay, let's get finished up. I want to show you a few resources you can look forward to on this topic. So in addition to our resource sheet that will be on the website under the webinar, there is a clinical distance learning series that is underway from the TA network and has been for some time. And if you're subscribed to the TA Telegram or get updates both from the NWI as well as the TA network, you will see that the clinical distance learning series and the TA network is putting out tons of fact sheets and examples of ways in which systems of care are investing in EBPs, including a summary of where to find listings of evidence-based practices. Next slide. This is just an example real quick of one of those. Some folks before the webinar said this would be important for them to see, and you're going to find out there in some of those resources that are coming down the pike a matrix describing some of the websites and resources for EBPs that exist out there, such as NREP, blueprints for healthy youth development, and so forth. And final slide on this topic. Again, you will find in our resource sheet a lot of resources that NWI has produced, including a couple of webinars on the topic of coordinating evidence-based practice with Wraparound. So please feel free to go look at our webinars right now if you'd like more in-depth review of this topic. Okay, we have two more topics to touch on. The next one, I think you've already heard me describe how I think one of the most important principles in Wraparound is being outcomes-based. At a family and youth level, we need to be measuring progress and feeding it back into the team process. At systems levels, we need to know whether or not we are actually achieving the outcomes we seek and are managing our costs effectively. And at programmatic levels, we need to do our supervision, as Janet was talking about, based on data and information. So next slide, please. I'm going to do this incredibly quickly because I think we have so many resources on this topic that the resource sheet is going to provide you with pathways to most of the information that I could even try and summarize here. But in 2 minutes or less, you will find that in the implementation guide to Wraparound, there's an overview of steps that you need to take in your Wraparound initiative or system that will get you to accountability and Wraparound, including how to establish clear outcomes, define your process elements, select measures of satisfaction, and so forth, and monitor services and costs. You can find this on the NWI website right now if you so choose. Next slide. We'll skip this. There's all sorts of description of the measurement and data options and the resources that you can find in the implementation guide and in our resource sheet. I do think it's worth just saying really briefly that our UW, University of Washington, Wraparound Evaluation and Research team has been working for a decade now to develop fidelity assessment tools that can keep the process aspects of Wraparound on track using tools such as the Wraparound Fidelity Index. We now have a brief self-report web-based short form of the WFI that families, facilitators, and youth can complete themselves on paper or via the website. We have a team observation measure, a document review measure. We feel as though these tools are really coming into their own and are quite reliable and valid at this point. Next slide. And one other resource you might consider is if you're ready to do a real comprehensive evaluation of your system or Wraparound initiative, we have a new way of trying to systematically collect a wide array of information across all of those areas: outcomes, fidelity, family satisfaction, leadership in the system, implementation drivers, and that is called the Wraparound Structured Assessment and Review. This is something that we can either support evaluators in your local system of care or Wraparound initiative to do, or that we can do ourselves. And the idea is to provide an external objective assessment that goes above and beyond routine quality assurance. Next slide. And like I said, it combines, it brings to bear fidelity, outcomes, implementation, and system data so that you can do a comprehensive quality improvement effort. Next slide. Last point I'm going to make is that there is now, we've entered the 21st century in wraparound. There are also electronic health records that align with the wraparound practice model. Choices Inc. and Wraparound Milwaukee have both developed systems that can serve as an electronic behavioral health record that aligns with wraparound practice. We've now created something called Fidelity EHR in partnership with our software development partner, Fidelity EHR. And if you would like to see more about that, you can go to their website. When you go to our resource sheets, you can find information about the tools of the Wraparound Fidelity Assessment System. You can get more guidance around how to build an accountable wraparound initiative, and you can see a bunch of webinars about accountability and quality assurance in wraparound. The new directions in wraparound accountability and CQI will give you more information about both WrapStar as well as the Fidelity EHR electronic behavioral health system that has really begun to impress a lot of folks about its comprehensiveness and effectiveness. And with that, I'm going to turn it back to Janet for our last innovation in wraparound.
Well, thanks, Eric. And this is actually, I guess, a kind of a set of innovations, generally under the topic of family and youth peer support and engagement. And I want to just launch our last poll real quick, which is asking you all to identify what the status of peer support is in the wraparound program that you are most familiar with or involved in. So again, you may pick more than one, although you wouldn't want to pick all of them because it wouldn't make sense. But we have family peer partner available to all WRAP participants, youth peer partner available to all WRAP participants, family partner available only to some or planned soon, youth partner available only to some or planned soon, or neither family nor youth peer partner coming soon. So let's give you 5 more seconds to do that, and then Amy, if you can give us the results. As always, I'm very curious to see what emerges from these polls. So almost half are having family peer partner available to all WRAP participants. That's a great number, and I think again represents probably something of a trend, and certainly since we started with this work, it's becoming more common. And even really 20% with youth peer partner is certainly a huge increase over even recent years. And then it looks like another third of people planning family peer partners, and similar, slightly fewer, and only 16% with neither available in their community or planned. Okay, thanks. So we actually get a lot of questions called and emailed in at the NWI about peer support and wraparound. Next slide, please. A lot of these are people who are looking for research that shows that it is effective. And I feel bad because I feel like we're giving kind of downer answers to this question, in that there is some evidence that families who participate in wraparound have higher levels of engagement and satisfaction when they also receive peer support from a family partner. This evidence is kind of weak, though, and there's not really any evidence so far that having a family partner actually has a positive impact on child outcomes. Now, that's not to say that there isn't an effect, just that the studies have not been done yet. And I also think that promoting engagement is a super important part of wraparound. For youth and young adults peer work, there's even less research. Not only is there nothing that shows an impact on outcomes, but there's not even anything indicating a positive impact on engagement. And once again, I think this is because the studies have not really been attempted, and youth peer support is pretty much still emerging as a part of the service array. I think there are many people who are eagerly waiting for new studies to be done, and there is some emerging research that is relevant to youth and young adult engagement and peer support and wraparound specifically, and I'll get to that in a minute. Specific knowledge about peer support across mental health field lags that for other more traditional roles. So not only is there little research on peer support in wraparound, there's not very much to go to for peer support in other mental health and behavioral health areas either. And of course, as I mentioned before, across this field, research on youth and young adult peer support is less and sparser than that for family peer support or adult peer support. In the limited peer-reviewed literature that actually does exist, researchers often point out that one of the reasons that peer support is so difficult to evaluate is that the roles tend not to be clearly defined, and so it's difficult to know if they're being carried out as they're meant to be or with fidelity. So within Wraparound, there have been some important initial steps toward defining the role of the family peer partner, particularly these two documents that were done kind of towards the beginning of the NWI's work under the leadership of Marlene Penn and Trina Osher. And some important work in this area is underway currently. Eric is leading an NWI effort to develop a fidelity measure for family peer support and wraparound. So look for perhaps an opportunity to be part of that development or testing sometime in the future. Okay, next please. Just like other key wrap roles, this is a reprise of what I said earlier, peer work in wraparound is extremely challenging. It requires peer supporters that have a variety of skills, you know, at a spectrum of skills that's equally varied and difficult as those that are required for a facilitator. And so as with any role like this, implementation science tells us pretty clearly that peer supports need training, coaching, and supervision of the same quality and intensity as that is provided for other key roles in wraparound. At the same time, the peer support role is qualitatively different from other provider roles and requires training, coaching, and supervision and organizational support that is role specific. Particularly, supervision needs to be provided and coaching from someone who's actually experienced in providing peer support and that focuses on aspects of the role and the challenges that are unique or pronounced in the peer role as compared to other roles. For example, how to use one's own experience and story effectively, managing trauma and triggering experiences, and keeping the role from becoming too overwhelming. Next, please. Of course, engaging families and youth in wraparound should not be only the responsibility of peer support, and as we know, there are many programs that don't have family and youth peer support available to all or even any participants. So engaging youth and young people in a meaningful way in wraparound has proven to be a particular challenge. My early research identified it as the CHOP challenge in wraparound, and so I've been engaged in projects over past probably 8 at least years that are exploring ways to increase young people's engagement, and that group of efforts we call the Achieve My Plan project. One of the things that we did at the outset of the project was some research to understand what really turns young people off during team meetings, and materials that we developed in response include this tip sheet and a series of others as well. Next, please. The core of the AMP work was to develop and test an intervention in wraparound, and we called it an enhancement, where the young people worked with a coach who was actually a college intern. And that could be someone with peer experience or not. We were about 50-50. We didn't have the recruitment capacity at that point to ensure that they would all be peers in terms of service experience. But with a fairly minimal intervention enhancement, we were able in our randomized study compared young people who got wraparound with AMP coaching versus not, able to increase a variety of different areas of engagement in wraparound. And you see across the top, this was engagement as measured in interviews with young people, family, and professionals. So most people did feel that young people were more actively and productively engaged in their team meetings. We also had video recordings of the team meetings, so we were able to do objective coding as well. So we think we have learned something important about how to do this. Next, please. And probably a finding that I like to show from our work is that this was a total of about 600 people that were part of the team meetings in any role other than the young person. pretty much everybody thought it was better or much better than usual. A few people that didn't like it too much. But that means, I think, is a good indication that people don't feel that by empowering the youth and having them participate more in the meeting, that detracts from the meeting or other people's ability to get done what they need to get done or to say what they need to say. And we're working on this currently and testing a version, next couple clicks, of what we call AMP Plus, which is a peer-delivered, specifically peer-delivered version of the GMI plan, which we're working on with Youth Move Oregon to test out right now. Next. Oh, and just again, we have the resource sheet that's available to you on the website. Next. Okay, so I think it's time for questions. Well, we barely nipped in under an hour with just the question part.
we were able to quote unquote finish within an hour, which is pretty good for us. But there have been some real interesting and good questions. So we hope that anyone who asked a question will be able to stay on board while we answer a few of these. If you do have to leave, obviously feel free. And everyone should know that the slides and resources we spoke of, which include 2 to 3 pages of hot-linked TA and information sheets and so forth, webinars, those summaries will be available at nwi.pdx.edu within the next day or two. So thanks to everyone for attending, and we're going to continue. If you asked a question but have to leave, you can always watch the video to get your question answered. I'm going to go ahead and start, unless John, you have anything else you need to let folks know?
No, there just were some questions about where they could find the webinar, etc. And the link that's on the screen right now will be the link where you find the webinar and all the resource sheets.
Okay, so I can answer one question that I was forwarded, which is when you mention using validated assessments as part of the apprenticeship phase of training to measure progress towards benchmarks of staff competence, are you recommending a particular assessment like one of the ones Eric mentioned? And this is a really good question, trying to distinguish between overall assessment of the initiative versus assessing skills. So this is a really good question. So what National Wraparound Implementation Center has developed is a measure called the Coaching Observation Measure for Effective Teamwork, or the COMET. This is a 40-odd item tool used by a coach or supervisor that's based on review of documentation and observation of the staff's practice. So the COMET is something that's really geared towards assessing whether the specific skills of wraparound across the 4 phases of effort are being demonstrated. The tools that I described in the Wraparound Fidelity Assessment System, like the Wraparound Fidelity Index and the Team Observation Measure, they get at similar things, but they really are intended more so for external evaluation of how well overall practice is going and whether fidelity is being achieved. So the subtle difference here is that one is really specifically geared towards collecting data on staff skill and giving that staff person feedback on their skills, and another one is more about the overall fidelity to the wraparound practice model. And in the interest of time, I'll leave it at that, but you can get more information from the National Wraparound Initiative and NWIC websites.
So, and I have here a comment actually sort of related. The comment says, we are in the early stages of considering wraparound implementation, have not yet had the opportunity for coaching or apprenticeship. I think that it's important to start thinking about this and perhaps persuading whoever's in charge to think about coaching. Apprenticeship is obviously difficult because there's no one to shadow, and perhaps there aren't experienced coaches. However, in a new initiative, it's really important to have some of that local expertise because somebody's going to have to be supervising the growing initiative and all of the people who will probably generally lack the kind of experience that we hope facilitators and others will acquire. And this kind of goes with another question about that notes they see value in the apprentice format but having difficulty with the financial repercussions. How are others managing this challenge? I think there are several things, one of which is to look across how you're doing your training and to recognize that without the follow-up coaching, the actual transfer of training into practice is very, very low. There are many studies that demonstrate this. And so you have to think about where are you putting your training budget. So that's one thing, is that maybe you want to think about doing more intensive focus on ensuring, especially at the early stages of implementation, that you're getting that coaching to happen. I think increasingly too that the use of technology is making it possible to do cost-effective options in coaching and training. If you're able to accomplish, for example, we think about the coaching, if you want to bring in somebody who's going to travel from out of state and you're paying their travel to come in for a couple of days, and maybe they'll see a couple wraparound team meetings. But to reinvest that in the initial training and then use some of these remote web-based and video-based coaching options that you can provide, we think, very, very high-quality coaching without the person who's doing the coaching and the observation actually having to be boots on the ground in your wraparound community. So those are options that we are exploring and learning about. The investment can be substantial, but to do it once and do it right is different from, I think, the experience that we've seen over time with a lot of places, that expertise is sort of nudged along for a number of years, never really kind of gets to that critical point where people feel confident in what they're doing, where they can train the upcoming next cohorts and generations of wraparound providers.
Yeah, I think the bottom line around that is that one way or another it needs to happen. There's a lot of different ways it can, and there's a bunch of stuff in the resource guide to Wraparound that provide options for thinking about how. But if you're not investing in some way, shape, or form, either within your agency or convincing and haranguing, system leaders to find ways to invest in it, you're not going to get to high quality practice, or at least not as high quality as it could be. I'll take on a couple other questions here. Is there data on populations that have the greatest need for wraparound? If so, what populations should be prioritized when making referrals to wraparound? So this is a really important system level question. And when you have a well-functioning CME or even just a community team that's kind of working together to get the service array well set up to meet the needs of families, it can be a very effective process. But so often wraparound initiatives are set up and people out there aren't necessarily thinking about how to refer to wraparound versus other options, which is unfortunate because, again, like Pat Miles says, if you know what to do, do it. If you don't know what to do, do wraparound. And I think it might sound a little trite, but that's kind of the essence of wraparound, is that wraparound is for the youth and families with the most complex needs, for whom a simple single intervention is not likely to, is not viewed as being something that's easily available. So again, you could have a youth with a real complex need like multiple offenses in the community, and MST or multisystemic therapy might be highly appropriate program to refer that youth to. You don't necessarily refer a youth to wraparound just because their needs are very intense. It's when needs are multiple or complex or multiple systems are involved that need coordination of care, coordination of effort, that we want to refer youth and families to wraparound. And I think that when you read through some of the care management entity literature, you will see some of that description about how important CMEs are for serving that purpose in a system of care that might have other intensive EBPs that also are available for youth with complex needs. The one other question I see here that's related from the same person, I think, is if the state structure does not include a comprehensive service array, such as one that includes, again, respite, mentoring, evidence-based clinical services, and so forth, can a program continue to be considered as implementing wraparound as an EBP? Well, so this is a very complicated question. I think that the most important thing is to recognize that if the state structure or your local structures do not afford a comprehensive, effective service array, you are not going to achieve as positive of outcomes. And it's up to your community team or those who are managing that system to figure out how to get that comprehensive and effective array of services and supports in place. Because again, if you don't, then your wraparound initiative and your wraparound facilitators are going to get burned out trying to find services that are going to be effective at meeting the needs of these families that don't exist in the community. So I don't think there's any rules or even research necessarily, although we have plenty of research that shows that when system supports aren't in place, you get lower fidelity, and we have other research that shows that poor fidelity gets worse outcomes. So you could say that we know that not having that system support of an effective and comprehensive service array leads to poorer outcomes, and that's what we're shooting for, is to get to good outcomes. So again, although it may not say, oh, you've been marked down and no longer are doing an EBP, you are likely to have less effective services.
And that dovetails neatly with a couple of other questions here. One person wanted to be reminded of the name of the assessment that Eric was talking about, the COMET. More information on that. Again, this is something used by NWIC. If you go to the NWI website, you can click directly through to NWIC to find out more.
Or just go to nwic.org, nwic.org.
Yep. And actually, by the way, I want to just put in another plug that also gives information about the hold the date, hold the season for our upcoming National Wraparound Implementation Center Conference. We're planning another one for the fall. Again, if you get on our listserv, we'll let you know when we get the actual dates nailed down. Another person asking what are ways to ensure real wraparound is happening versus case management and just talking about the issues and not planning. I think as we've been sort of a theme to what we've been discussing now, you know, the WFI is an indicator there, as well as, again, if you're looking at practice through use of the COMET or a similar tool. There's also a question, this is a big issue, I would like to know about the billing. This is an issue for providers. We do have a webinar that we recently did about Medicaid, I believe, archived on the NWI website. So that should be helpful, I believe. We're thinking of doing some TA resources in the upcoming year that will focus on that issue as well.
Right, and there's going to be a webinar, and John will have to remind us when, about how to do wraparound in a Medicaid fee-for-service environment. I can't remember when we committed to do that, but I think it's coming up later this year.
Right, I think that one might be in the fall.
Yeah, our next webinar is actually about research-based strategies for increasing youth and young adult engagement in wraparound, which kind of builds off of one of the themes we addressed today, and that will be on March 29th. That's a Tuesday at 11 a.m. Pacific. So please sign up for our newsletter and stay in touch with us for more about that.
I have another question actually for Eric on the fidelity study. This was the Nevada one. Was the score, I think this was for the WFI, was it facilitators, team members? Who was providing those ratings that were in the diagram?
Yeah, those ratings on the WFI were from the caregivers, which is, you know, the most consistent and probably most consistently useful data that we get from the WFI is from parents or caregivers, because you know, younger children can't complete the WFI, and facilitators may have a skewed perspective. So those are from the informant that we consider probably most useful, which is the parents and caregivers. I'm going to let Janet and John conclude because I actually am now late for a meeting. But it has been a wonderful hour and 15 minutes to spend with everyone who is on the webinar. Perhaps Janet and John can address one last question or two, and we will conclude. Thank you all so much for joining us today.
Well, thanks, Eric. See you later.
Bye.
I actually feel like we've done a pretty good job of covering most of the questions, and I think we've pretty much exhausted everybody's patience, as I can see that our attendance is dropping off pretty rapidly right now. So I'd like to thank everybody for being here, for submitting your questions, for being an engaged audience and helping us do those polls, which gave us, I think, a really nice snapshot of at least what our audience today is up to in wraparound, and some pretty good news, I think, about wraparound in general. So thanks again for being on. And as John mentioned, we will be having another webinar in not too long. So any concluding remarks, John?
Oh, that's it. Yep, just stay tuned for our next webinar on Tuesday, March 29th at 11 a.m. Regarding research-based strategies for increasing youth and young adult engagement in wraparound. And I think that's all we have for today.